Can you walk on your tippy toes down that way? Tippy toes. Good job. Then you want to kick it back? So good, look at you. I became a doctor because I wanted to help people. Deciding pediatrics was really easy. I love kids' resilience. I love the way that you have to be so creative and really come up with new ideas about how to engage them, because you can't just ask them to follow instructions during the exam the same way as an adult. And I think that challenge is so fun and fascinating to meet them where they're at. And then also working with families. It's just so incredible to see how dedicated they are to understanding their children's condition and managing it the best they possibly can. I'm Miya Bernson-Leung, and I'm a pediatric neurologist at Boston Children's Hospital. This patient we are following because he has this very subtle narrowing of one of his vessels, which can be a side effect of meningitis. There's no such thing as a typical day in my job. I see everything from common things like migraine to incredibly rare genetic disorders or cerebrovascular disorders and everything in between. I'm also one of the neurologists at the Stroke and Cerebrovascular Center. A lot of people are really surprised to find out that children can have strokes. It's something that can happen even to kids that were previously healthy and didn't have a particular risk factor for stroke that we knew of. It's also, unfortunately, pretty common in babies, and so we see a lot of survivors of neonatal and perinatal strokes as well. It really varies what you may see in terms of the symptoms of a stroke for a child. Some children may have trouble with language, either understanding or producing language. Some people may have overall cognitive challenges, social and emotional challenges, trouble with vision. It can really be a range of symptoms. And so that's one of the things that really motivates me as someone who's passionate about education, is to try and get the word out so that we can therefore improve patient care by having everybody in the healthcare field who might be intersecting with those kids be aware, know what to look for, and also what to do.
I happen to look the guy.
Oh, you do?
Yeah. I do like that.
You do like that? Good. One of the most interesting things about taking care of kids with stroke is that you're there at the moment when everything is unfolding, and it's probably one of the hardest days of their lives for that family. And then you also get to see them in clinic days, weeks, months, years later, and see how much they've progressed, how much they've grown, and really be there walking beside them every step of the way. That's one of the things that drew me to this specialty in the first place.